doctors, I'm Dr. Muhammad Ahmadullah. You can call Dr. Scalpel Artist. Teach you about this instrument. So what is this instrument and what are the instruments which are similar to this and what are the anatomies of this instrument and what is it used for? I'll explain you all the things. Okay. Now look at here. Here we are having this portion. This is called as the tip of this instrument. And what is this instrument? This is the needle holder. Okay. So this is the tip. This much clear. Now look at it. When you open this, can you see from here till this point? This is called as the jaw of the needle holder. So what are the characters of jaw of the needle holder? Look at here now. Once it is open, you can see multiple crisscross cuttings are there, right? So they are called as crisscross serrations, and within the serrations one small cut is there, right, along the longitudinal axis. So this is called as the groove of the needle holder, but even some persons use the word slit of the needle holder. I hope you understood. Let me revise once again. This is the tip of the needle holder, then you are having the crisscross serrations of the needle holder, then you are having the groove of the needle holder. So what are this purpose of these grooves as well as what is called the crisscross serrations? It provides grip in between the needle holder as well as the needle. Understood the point? Now let us go further. Now I hope you can understand. It is rotating. This portion is rotating along this, right? So this point is called as the hinge of the needle holder. So when you talk about the hinge of the needle holder, there are again two types are there. In this case, it was somewhat rectangular. Can you see this one on both the sides? So this is called as box type of hinge or box lock, you can say. Understood the point? Other one, at the same place you may have a bolt type. So what is a bolt type? I hope you remember the bolt screws, etc. and all. So similar to that you may be having, and you'll be having a cut within the bolt. So that is called the bolt type from here till this point. So this is called as the shank of the needle holder, shaft of the needle holder, or stalk of the needle holder. Okay, so here we are having two stalks are there. Similarly, two jaws we were having. Now let's go furthermore. So I hope you can see this circular structure, right? So this is called as the ring of the needle holder. Okay, so what is the ring of the needle holder? What is it for? Here is the portion where we are inserting our fingers to hold this needle holder. So what is that rule? Again, I'll be explaining you in another video. Now look at here. Here you can see multiple steps like or cuttings like are there within this, right? So this is called as ratchet of the needle holder, lock of the needle holder, or clutch of the needle holder. So how are they closed? How are they open? Just look here. When I'm just pressing these two things, it is being locked. Now I hope you can understand. It is not being, even though I'm pulling very hard, it is not being opened. So what is the proper rule? You'll be pulling, you'll be pushing both of these rings on the opposite direction. Just look here. Did you saw? I was pulling this part and I was pushing this part. Understood? So let me explain you in detail about how to lock it, how to hold it. So let's talk about it right now. Now look here. Before that, let me explain you about what are the rules for holding the needle holder. So you are having the 5 fingers, right? So this is the first, this is the second, third, fourth, and the fifth you are having, right? Similarly, this is the ring finger, middle finger you are having, index as well as the thumb you are having. So in one ring, you will be placing the thumb. In the other ring, you'll have the ring finger. Okay. So what about the middle finger? Middle finger will be placed in the area where the stalk and the ring where you are having the ring finger meets. So this is that area. Understood the point? So what is the function of this? Function of this middle finger here, it provides the support. Now what about this index finger? It will be placed at the stalk close to the box. Understood? And it is giving you the support for directing the needle while you are driving the needle. Understood the point? And what about the ring finger? Ring finger is little finger is completely free enough. So you will be holding in this way. So which are the fingers used? Thumb as well as the ring. So this rule is called as thumb ring rule, or in other words we can say this is the first finger and this is the fourth finger. So this is also called as 1-4 rule or 1-4 technique or thumb ring technique of holding the needle holder. So now let me remind you one more things. Any medical instruments which we are having with the rings, 2 rings in that instrument, will be using the same technique, whether it is surgical scissor, whether it is mosquito forceps, whether it is artery forceps, hemos, or whatever it is. Understood? So that is the rule. So thank you for listening to me. Now one more thing. Okay, I forgot one more point. Now look here. Here till this point, till here, this is called as the overall length of the needle hole, this much. Understood? Thank you.